Good evening. Good evening. Good evening. How are we doing today? Oh wow, 7 o'clock already. I thought I'll sign in early, but looks like time started. Hi, good evening everyone. Good evening, good evening. Thanks for joining us today. Thank you for joining. I hope you're having a beautiful summer day where you are. Um, this is the Feminine Health and Fiber Support Network, and today we're having a conversation. By the way, July is Fibroids Awareness Month, so we're having a conversation today around the facts and the myths around fibroids. Some of the lies that we have believed, some of the things that have held people back and not being able to speak up around fibroids. But before we go into all of that, as I will usually do, I will bring you the word for today, my scripture that I was meditating on today. It was for me it was Romans 8:28, specifically the Passion Translation. It says, "So we are convinced that every detail of our lives is continually woven together for good, for we are his lovers who have been called to fulfill his designated purpose." And for me, that stood out, that we have been called to fulfill God's designated purpose, not something that we come up with, but his purpose. And as I was pondering on that, I'm like, so it's key, it's essential that I find out what his purpose for me is, and I just stay in that place and grow in that place. I thought I'll encourage us with that. I was thinking about that a lot today. And also that even whilst we find his designated purpose for us, we still need to, we need each other. Your purpose, my purpose is different in him. His plan for us his plans for us are different, but we need each other, to pull through and become, the fullness of who he has created us to be. Today it doesn't seem like I can speak properly, but bear with me. I am tired. I've been, but I'm here. And so everyone who's joined, thank you very much for joining. And I've got two wonderful people with me today. I've got consultant gynecologist Miss Omar, who's going to be answering some of our questions, around the facts and the myths. And I have also a mentor and a lifestyle coach who's going to bring in some balance, to some of these issues that we go through as women, especially regarding fibroids, and balancing, to get to a place of wellness. So this is a Feminine Health and Fiber Support Network. We provide support in our community through relevant conversations like this, hand-holding, peer-to-peer support. Education for us is important, is key, lifestyle guidance, encouraging women to speak up, around feminine health issues, and promoting mental health awareness, and dealing with, honestly, cultural and religious biases that women face as regard to feminine health issue. Again, July is Fibroid Awareness Month. Fibroids for me is close to home because I went through that journey. Next week, by the way, we're going to be bringing women who are going to be sharing their journeys with you. I'm going to be joining them as well and sharing, my journey. And for us, it's all about educating and helping one another as women, and also bringing hope. And let's not believe some of the lies that's out there, around fibroids. And you can thrive on, with fibroid, and you can have a good life, if you know what to do. So that's where we are today. I'm going to bring in my guests. I know I've seen Dr. Omar, I've seen Angela as well. John, thank you everyone who's joined. Bear with me one moment. Yeah, I see I see both of them. So have we're gonna have two segments. The first part of it will be with the consultant gynecologist helping us. Hi, Dr. Omar.
Hi, good evening.
Good evening. How you
I'm
doing?
fine, thank you. How are you?
I'm very well, thank you. I'm very well. How you doing with the
Uh,
new baby?
yeah, oh my God. As soon as I have some time, I'm just rushing there to see him and come home.
Oh, that's so cute. Well done, well done. I'm trying to find Angela
Mm-hmm.
and bring. Oh, there you are.
Yeah.
Hi, Angela. Good evening.
Hello.
Hi.
Hi, how are you?
I'm very well, thank you. Good to be
Thank
here.
you. Thank you for joining us. Good evening. Thank you, everyone who's joined us today. So, like I said earlier on, today we're talking about it's Fibroids Awareness Month. And today we're talking about facts and the myths of fibroids. Something that we should not believe the lies that are out there about fibroids. Honestly, it's all about the education, the information, and the information that you act upon. You know, and getting the balance to live a good life, even whilst living with fibroids. I'm going to let the ladies introduce themselves. First of all, if you go, Dr. Omar, you tell us about
Uh,
yourself and your work, and then I'll let Angela do it, the introduction as well. And like I said earlier on, we're going to first of all do a bit with Miss Omar, and then Angela, you come in later on. With you as a coach and a lifestyle person, I just want a bit of that balance, because either we like it or not, there's, apart from the health aspect of living with feminine health issues, there's also the psychological, mental part of it. So this is where you bring in balance for us today. Thank you very much. I'm glad you could join me today in this conversation. If you want to go first, Dr. Omar, please introduce yourself.
Hi, good evening, ladies. I don't know if there's any gentleman also listening. I am Kazal Omar, the consultant gynecologist, working for over 35 years in gynecology and obstetric, but currently I'm just doing gynecology. I work in a private circle and Nuffield Brentwood. Unfortunately, I had to leave the NHS, but I'm still passionate about it. Yeah, I left the NHS in November 2003. Yeah.
Oh, well.
Yeah.
Okay. Well, we know some of the work you've done in that space, but well done, Dr. Omar. And so what you're still adding value even in the bit of the one where you're still working. And I know you've also wanted to wind down. Now you're a grandma, so maybe all things work
Yes,
together.
yes. I've been warned by my daughter. Mom, I need time more. I need your time more. I said, okay, we will squeeze every 2 days in 1 day, see what we can do.
Oh,
I can't.
goodness.
Yeah.
Goodness. Oh, yeah.
Thank you.
Grandma duty is calling. All right. Thank you very much. Angela, did you want to go next, please, and introduce yourself and also tell us a bit about around your work?
Okay. So, hello, ladies. Once again, a pleasure to be here. So, my name is Angela Teller, and I am a mentor and a business strategist, and I work with female entrepreneurs, business owners, and leaders, and I help them to become the best versions of themselves so that they can then move on to achieve maximum success from the inside out. Success begins on the inside, and one of the things I found is that true success begins on the inside and then it's amplified on the outside. And so I'm looking forward to unpacking this conversation, particularly around the things that, from an inside point of view, so that affects the outside. Oh, we've got a cat. We've got one. I wonder if it's a lady cat joining the conversation. Is it a lady cat?
Sorry.
No, it's
Thank
beautiful.
Thank you for that. Thank you for that, Angela. And honestly, one of the goals that we have, as on this platform in this community, is to have an environment that women can thrive in, able to speak up, and be empowered, honestly, to live their fullest lives and achieve the very best that they can. So this is why today you come in, even though we're talking about fibroids and all of that, for us, it's about the advocacy, the education, and creating awareness and what's possible, even for women. So thank you, ladies, for joining me this evening in this conversation. But I'm just gonna jump right into it. Around the facts, some of the facts and you tell us, Dr. Omar. I'll go with you first, Dr. Omar. And tell us a bit more about some things that people have believed, which is not absolutely true. So, like the first one is fibroids are cancerous growth in the uterus. Dr. Omar, demystify that for us.
Yeah, fibroid is not a cancer. Fibroid is a benign condition which is growth from the muscle fiber, and it is the cancer risk is happen from the fibroid is 0.4 per 100,000. So the fibroid is not a cancer; it's a benign condition, but unfortunately can be debilitating, but can be treated and is not changing unless if there is any. I can explain later if there is any sign which is making us to be worried if there is any change of cancer, which I said is very, very rare. It is 0.4 per 100,000 of the fibroid affecting women. But the cancer is by itself is called sarcoma. Sarcoma can happen without any fibroid. Will not happen from the fibroid only. It can happen by it itself without fibroid. But fibroid is not a cancer. It's a benign condition. It is coming from the muscle fiber, just grow, and it has a lot of factors which is causing, as we explained in the past, overweight, eating a lot of red meat. The smokers have less fibroid. That is a advantage, but I'm not encouraging anyone to smoke because smokers have less fibroid. Yeah, and also the genetic predisposition is the most important one, and we all know that is very common in the African Black women. As well as it is also it's common in Eastern European. Recently, I have seen, because there's a lot of Eastern European women in the country, I have seen a lot of them. They have also fibroid, which is yes, but it is not a cancer.
All right, thank you for demystifying that. So number one is that fibroids are non-cancerous tumors. So do not believe a lie that fibroids are cancerous growth. And also, we've also heard from Dr. Omar. She said is 1 in 400,000. So it's
0.4, 0.4, not 4 in 100,000. 0.4 in 100,000. It means like 4 in a million.
So it's really rare that these tumors can turn into cancer, but the chances are really slim. It's not like it's zero, but
yeah.
But the first and foremost is that fibroids are not cancerous.
Yeah.
Very much for demystifying that. Okay. The other one that I wanted to raise was around pregnancy. If you have fibroids, can you get pregnant? Can you stay pregnant?
Yes. As a lot of women, they not know that they have their fibroid until they are pregnant and they have an ultrasound and they found out they have a fibroid. And most of the women, especially when they have a bit in the earlier life pregnancy, in their 20s and 30s, they even not have any symptom or may have some heavy bleeding, painful bleeding, but they never had a scan and they can be pregnant, of course. Not always they have infertility, not always avoid the pregnancy. A lot of women, they have a pregnancy and they didn't know that they have fibroid, but later on, during scanning or examination, they found out they have a fibroid.
Awesome. Thank you so much for that. And honestly, another bit that I wanted to emphasize is the staying pregnant bit. Also, because honestly, this was also my life at some point, and I've had stories of young women, well, in the community, a Black community, where young people didn't want to talk about fibroids and all of that, even if they were going through it, because there was chances that, someone's going to hear, someone's mother is going to hear, and she's going to say to her son, "Do not marry that girl. She cannot give you children because she's got."
Yeah, that's true. That's true, especially in villages. Yeah.
Thank you for demystifying that, because if you have fibroids, you can be pregnant and you can stay pregnant. I had fibroids. I got pregnant.
Yeah.
Okay, I got a number of miscarriages, but that's also another conversation for another day, because it also depends on where the fibers are sitting and what's causing the miscarriages. But
Yeah.
if you have fibroids, you can get pregnant and you can stay pregnant. You can carry pregnancy to full term,
Yeah.
So thank you for that. Another one that I wanted to also raise was around the age for fibroid. There's a myth that you can only have fibroids, when you're like in your 30s and 40s. Is that a myth or a fact?
No, it is. It can happen in any age, and it can be slow growing and can be rapid growing. The as I said, the factors which causing the fibroid exist, and also it exists in any woman which have these factors. So the fibroid can be happening in any age, whether it is from the date when the period start and the hormone starts. So it can stimulate the fibroid. So maybe by mid-20s is showing, and then if it is, some people, they are very unlucky. The fibroid, it grow very quickly and respond very quickly to the hormone, and also they have a good blood supply, so they can be feeded very well. But the other fibroid, they are in a place which with the feeding by the blood vessel and going to have a hormone stimulation is less. So it's a very slow growing. I have seen women, they come from my 20s. I know I have 2 small fibroids, and you examine them in their 50s, is the same. They have the same size of fibroid, but some women, they just have so much feeding with the blood vessel and hormone effect, then the growing. But it can happen, can be seen, can be diagnosed, can be treated in any age. I have seen it in 70-year-old. They had a fibroid sitting on the top of the uterus and was sitting in the back of the womb and couldn't pass urine. And then I found out it is because of the fibroid pressing on the bladder. So any age can have a fibroid.
Thank you.
Yeah.
Thank you very much for sharing that. That's really useful. Before I go to Angela, I wanted to ask you this one question also quickly. So what role do genetics play in the development of fibroids? I know we've mentioned about hormones and all of that, but because we're talking about age now, like in the 30s or 40s or whenever it is that people think that you can have fibroids. What role does genetics and also the hormone play in fibroids growth?
The genetic is very common for some reason, because the collagen tissue in a black woman is very strong. The collagen, if you see the skin, how beautiful, and fibrous tissue in the black woman is more stronger. So I believe it's still, we don't know exactly what is the reason why the fibroid it is more, but it is, say, genetically predisposed. It is something which is different. The fibrous tissue and the collagen tissue in a black woman is much stronger, and possibly the response to any even normal hormone or normal blood supply, it's exaggerated than the white people. But the other, the hormone is, as we know, any hormone, whether it is a normal ovarian function, or it is a combined pill, or it is a hormone replacement therapy, as well as the diet. We know the diet, especially the soya, have a lot of estrogen, yam have progesterone. So these diet also has effective on a growth of the fibroid. But genetic, it is, I think, a structure. The structure is different, and the structure is much stronger. So when it is too strong, I think the response is more exaggerated to the hormone and the blood vessels around the uterus. And you have a nice skin, you have a nice collagen tissue, but unfortunately, the negative side of that is a fibroid, which is happening in the uterus. Otherwise, the rest of the body is beautiful. Is beautiful, no wrinkle, no stretch mark, so nothing. You don't need Botox, you don't need collagen, you don't need filler. So that's the positive side of it.
Let's leave it there. Thank you very much for that. And honestly, that reminds me about a conversation I was having a few days ago. I've been somewhere and I was offered yam every day. And I thought, you know what? If
No.
I had fibroid, these people are killing me with this yam that I've been given every day for
Yeah.
me. I just had things I want to talk about. Angela, I'm gonna let you chip in with this yam because I come from a place where we eat a lot of yam. Okay, in menopause, yam might be good, but before you hit that menopause, eating yam every day is not a good thing, you know, especially if you're living with fibroids. So I was saying to these people, can you not give me yam to eat every day? You know, so Angela, please chip in on that. But whilst no, you go first, and then I'll ask you a follow-on question that came to mind. You know, before this yam issue came to my mind.
Yeah, well, I think this is a very interesting conversation to be having in the first instance because it's a very prevalent issue within the African and Afro-Caribbean communities, and it's just interesting to discover that it's also the same in the Eastern European communities.
Yeah.
So, I think, as with anything,
Mm-hmm.
I believe in moderation. Moderation is key. That's just a principle of life. Balance. You need to be balanced in every area. So them offering you yam every day is that's not quite balanced, is it? So
Yeah.
so
It's not bad.
the key is just balance. Everything in moderation, and everything should be okay.
Moderation is the key. I hear you. I hear you. You know, and as with fibroids, can you share with us any technique, you know, for managing emotional roller coaster that come with being diagnosed or living with fibroid? Because honestly, I can tell you a bit, but tell us, you're the expert. Tell us what technique, how, as a woman living with fibroids, you've been diagnosed with fibroid. How do you try to find balance, especially in your mind and in your emotions?
Yeah, well, I think the first thing is, on average, women, we tend to be more emotional than men.
Mm.
And as with any diagnosis, particularly, a negative diagnosis such as this, it's unwanted. And the natural response is, when you get that information, your emotions kick in, and that's great, though. It just shows that you're functioning.
Mm-hmm.
Emotions are not a bad thing.
Mm.
We need emotions. Emotions are, I mean, they're a way of expressing ourselves. We need to be angry at some point. We need to be upset at some point. We need to be happy. We need to be sad. These are just normal. The problem comes when we allow our emotions to lead.
Mm.
That,
Mm.
that's when we have problems, just across the board. So the key thing is understanding that there's nothing wrong with having an emotional response.
Mm-hmm.
It's just becomes a problem when we then allow the emotional response to take over and to lead.
Right.
And somebody once said, they said that emotions are very, very poor leaders.
Mm.
And so the key thing then is we need to learn to manage our responses. And one thing I mean, when a woman has fibroids, it can be a very emotional thing, and it depends, like the doctor was saying, it depends obviously on the location and the impact it has. Some women have fibroids and there are absolutely no issues at all. Other women have fibroids that have maybe been impacting them, obviously before diagnosis.
Mm-hmm.
And then when they are diagnosed, first there's that initial relief that at least we now know why. For instance, with the case that the doctor shared, why you're not able to pass urine. But then the next thing is, oh, okay, now we know what's going to happen next. Okay, so the important thing is just managing those emotions and beginning to and taking the perspective that, you know what, this situation I'm in, I need to be in control.
Mm-hmm.
And one way of doing that is having a support system,
Thank
someone
you.
you can talk to, you can share. And that's one of the beauties of being a woman. We love to talk, don't we? Just throw a group of women who don't even know each other into a room,
Mm-hmm.
lock the door. When you come back, they're all talking. You
They're
can't
all
say the same
friends.
for guys. So we need a support system, and your support system could be, it could be your friends, it could be family members, it could be an expert, it could be a counselor, whoever you feel comfortable with. So it's okay to then speak up, about how you're feeling and to process the emotions. Okay. And then that way, you're not letting your emotions just dictate to you how you're going to behave.
Awesome. Thank you very much. So not allowing your emotions to be the ones leading you, learning to manage the emotions. Yeah. So absolutely, I agree. And thank you for that. Something came to mind, and absolutely, I've it left my head in a minute now. But honestly, sometimes, yeah, you highlighted. That's it. You highlighted the support system. This is key on this journey, honestly, because we cannot underestimate the power of sharing with someone, power of hand holding, power of someone who has had similar experience similar that they can share with you, and you can leverage on what they've had to go through, and then you don't have to suffer that same thing that they suffered, because you can do something differently, or you can just create your path in a better way for your own wellness and well-being. And thank you for that. The support system thing is really key.
Yeah,
Thank
and
you.
I might just add, and that's why the work that that you do as FHS is very important, because you're creating that awareness and you're providing a forum for women to come together, and like you said, to have those conversations. And like you said, it's so important, that whole thing about sharing. There's nothing like talking to someone who has walked in your shoes. You don't have to explain yourself, and you know that you are understood. And one of the key or fundamental human desires is that desire to be understood. We all want to be understood. And so being in a forum where you can be understood, or when you're with someone who you can, look back and say, yes, they understand, it does something for you as a person.
Indeed, it does. And that's why the community is important. Talking to someone is important. Finding a support system is key. And it just reminded me and sometimes it can be, oh, am I frozen? Is everyone as frozen? What's going on? Can you hear me?
Yes, live and clear.
Oh, okay. I thought
Not frozen.
And sometimes, the community, the people, sometimes, if all you can even find is just a chat or a video or something and for me, it happened that way because I was looking for a support system. I was looking for a support network. Miss Woman knew, and I was pulling my hair like, I need someone who's had instructed me to tell me how I'm going to feel like after this has happened. But there was no one. But all I had was a video that my husband found on YouTube. Someone, because I could relate with her. She's from the country where I'm from. And I thought, okay, if this young woman can, well, not so young, but can share her story. And that was where I held on to, honestly. That was all I could find. And I held on to that. I'm like, okay, if she's okay after this, I'm going to be fine. And sometimes, and that's all someone needs, And so, yes, this support system community, we need to speak up. We need to just find people who can help us, hold our hands as we journey this. Thank you very much. Another one that I wanted to fact or myth that I wanted to check with you, Dr. Omar, is I know we talked about getting pregnant and staying pregnant. How does fibroids impact fertility?
The fibroids depend on where it is, because we have 7 types of fibroid, and one of them they call it 0. The 0 and 1 and also 2, which is sitting inside the womb. The 0 is completely inside the womb, and also the 1, it is inside the womb, but it is on the stalk, and the 2, it is half in the womb, half in the wall of the womb. That is definitely is like a foreign body. like how you have a coil. The foreign body is sitting inside the womb, so it makes the implantation never happen. And even if it is happen, it's happen in a wrong place, inside the fibroid, and doesn't grow. So it is like very early miscarriage, with the woman even doesn't know if they are pregnant or not. The second type, which is may affect the position of the tube as well as the ovary. So the eggs may be released, but does not find their way to the tube, or they sitting beside the tube and causing blockage of the tube. It's rarely happen in both sides, but can still happen. So that is affecting the fertility. In addition, if the woman have continuously bleeding, if they have continuous bleeding, so a lot of women, they are bleeding and bleeding. So how you expecting this woman can have a proper ovulation and proper intercourse to have the fertilization and having the pregnancy? So these are the factors which is affecting the fertility by itself. But also the affecting the pregnancy, even if it has happened, as I said, especially type 0 and 1 and 2, can also cause miscarriages, because they are not implanting in the right place. So they implant even if for a short time, 5 weeks, 6 weeks, then they will have a miscarriage. And again, if it is too many of them, it's increased the size of the womb, and it is overstretching of the womb. So they have late miscarriages, because it is still is not, the placenta is not having a good nutrition, and the pregnancy doesn't grow. And later on also it causes premature delivery. Why it is causing premature delivery? Because the womb, when it's stretched to the pregnancy, to reach the stage where 38 week or 40 week, and some women, they have a fibroid, it is look like in 24 week or 23 weeks or 28 weeks, it look like the full term. So it is so stretched, then the stimulation of the hormone is happen. So then they end up with a premature delivery while the baby is not ready to come out. And that's also affect. And are they not surviving, or they have a lot of disability later on? Then affect on the position and presentation of the baby. If you have a lot of fibroid inside the womb and outside in the wall of the womb, that will affect the baby's head not to come down. So it can come with the bottom, or coming on the transverse position, so foot on one side, head on the other side. And this is a risk also of the water break, cord prolapse, and emergency cesarean section, and also elective cesarean section. In addition to that, also cause contraction after delivery. So the contraction after delivery is very important to avoid loss of blood. So if the fibroid is too many, then the contraction is not going to happen as we expect it to. So they end up having a lot of bleeding, and the bleeding also causes blood transfusion, and the woman is not going to be recovering very well to look after her family and herself. So it has effect if pregnancies happen or if it's not happening.
Definitely. Thank you very much for that, Dr. Omar. And honestly, for me, I will say, I mean, all of the symptoms, the things that you talked about, happened to me with my daughter when I was pregnant, and I had to go to hospital early, all of that, because the baby, because of the position and the sizes of fibers that I had. So, I mean, for any woman who's living with fibroids, I will say it is important to know the positions of everywhere they are and the size, because you are armed with information. You know what you're dealing with. And that way, because you have information and you have knowledge, there are things that you can do differently because you know things, So thank you very much, Dr. Omar. Another one that I wanted to ask, was around, if you have fibroids, you will have heavy menstrual bleeding and pain. Is it always the case?
Yeah.
So that's a fact, that if you have fibroids, you will have heavy menstrual bleeding.
As I said, it depends on the size and the site again. The heavy menstrual bleeding is one of the signs. So if it is too heavy, too painful, it's much better to be investigated very early in life to see if they have or they don't have the fibroid. or any other reason which causing this heavy and painful. But there are people just by the family, they have very heavy and painful period, but this is in the past. They said, oh, your mom have it, your grandma, but it's better to be investigated and at least to know whether they have a fibroid or any other diseases like endometriosis. It's better to know from the beginning before this affect all the hormone life, social life, even the school cannot, the girls cannot go to school, cannot go to university because of the pain and bleeding, and then can be sorted before all this is happen, or they can control it, whatever the tools are available for them to control the symptom if they have this problem, and knowing the diagnosis.
All right. Thank you.
Yeah.
Thank you very much for another myth that I wanted to demystify is hysterectomy. Is hysterectomy the only effective treatment for uterine fibroids?
No, it depends on the age, depend on the fertility, and depend on the site and size of the fibroid.
Mm-hmm.
The hysterectomy can be final when the woman is no longer, they have finished their family, they don't want any more children, and near to the menopause.
Mm-hmm.
It's a final treatment, the hysterectomy. If they are, for example, 48, 50, I would prefer to offer the hysterectomy than taking the fibroid. Because taking the fibroid, it causes a lot of scarring. And by nature, when you take, how much you take the fibroid, there is a risk of recurrence. And when the recurrence happen, then the woman go another surgery. And the most difficult, and I afraid of how many fibroid I have operated on, whether hysterectomy or taking the fibroid away. The fear which I have in my mind when I go back and do a surgery for a woman already had a fibroid removed before and now it is a recurrence or they need a hysterectomy, because the sticky point of the fibroid removal scar is so bad. Sometimes, one time it's happened to me, I couldn't even open the abdomen. It's so scarred, and it is everything was stick together. So she lost all the bowel or bladder or ureter, or to close it is better, and unfortunately she had to live with. So the hysterectomy is not the only choice. No, there is a lot of other things we have to offer, especially now.
Now, absolutely. Thank you. Thank you. That alternative treatment, that can be explored before you get to the final. If you ever have to get to hysterectomy, there are many other options that you can explore. I just wanted to put that out there. But whilst we're here, you answered one of the questions that another myth that I was going to demystify, which is that once fibers have been removed, they cannot come back. And it's going to get me to a question that I have for you, Angela. But Ms. Omar, did you want to, once and for all, also add that fibroids can come back after myectomy?
Yes, yeah, I can come back.
So we know that these fibroids can grow back after myectomy.
Not the same one. It grows somewhere else inside in the womb. You take it off. Yeah, but there is another area will make another fibroid.
Yeah, because if you haven't changed, if things are still the same before your fibroid removed, your lifestyle is going on as the same, they come back. So to this question that I was going to ask you, Angela, around lifestyle choices, for women, how can diet and lifestyle change manage fibroids and fibroid regrowth? Is there any pointers that you can give women, who might be living with fibroids and who've had myectomy? Now we've had Dr. Omar tell us that the fibroids can grow back after myectomy. Any suggestions, any guidance for women around lifestyle and diet?
Well, the key thing then really is just around the hormones, because it's the hormones that push the fibroid growth. So it's looking at making sure that you're having a healthy, balanced diet, It's ensuring that, for instance, we touched earlier on soya. You know, soya does mimic estrogen. So it's just being aware of certain foods that can mimic estrogen and in a sense then go on to worsen things. So it's just more of an awareness thing really. But that balance is so key, like I've said already.
All right, thank you for that. So it's also important imperative that we understand the kind of lifestyle that helps us do well and thrive, while lifestyle change, you know, I'm sorry about that, someone's blasting my phone. There's definitely need for diet and lifestyle change. So knowing about food and which foods will add to fiber growth and which ones will help shrink them, you know, is really important, you know, if you're living with fibroid. So diet and lifestyle change is important for fibroid. Another one that I wanted to ask you, Dr. Omar, is around fibroids disappearing after menopause. Is this always the case?
Fibroid disappear?
Disappearing after
No,
menopause. So
no. It's
women,
shrink.
women are advised to like, oh, just wait on menopause. You're nearing menopause, so just wait it out until menopause. And I mean, I've been told that.
Mm,
Well, I was told that
yeah,
just wait it
yeah.
out until menopause, and then you'll be fine and all of that. So fibers, do they disappear after menopause?
Fibroid can shrink after menopause because we know that the hormone is affecting the growth of fibroid. But bear in mind that the sign and symptom of menopause is not simple. So, and also availability of bioidentical hormones to support the menopause is available. So if you have a lot of symptom and also working in the past, even if when the woman was working the most 50, 52, 53, and then nowadays everyone is similar to the men. They will work later and later and later. So you can't be having menopausal symptom and working in the environment which is stressful and whole days and pain and ache and estrogen deficiency and estrogen deficiency, it causes a lot of bone density problem, and the HRT is available, it is good one. So when you take HRT, then the fibroid will grow again. So a lot of women before giving them HRT and they have a fibroid never been told that. They come to me and never been told that the fibroid can grow again, because when they start feeling pain or heavy bleeding, they say, oh, I don't know why when I started my HRT, then now I am having, because your fibroid is growing, because it's a hormone. Again,
Yeah,
it's a
yeah,
hormone. So,
yes, yeah.
yeah.
So those are the things to be aware of, you know,
Mm,
honestly.
mm,
So there's no hard and fast way about all of these
mm,
things. I
mm,
mean, fiber is supposed to shrink in menopause,
mm.
but if you're also taking pills or taking therapy for
Yeah,
hormones to help balance your hormones,
yeah,
that can also increase. So
yeah.
it so I'll say that honestly, menopause is not a solution necessarily
No,
if you have
no,
if you have fibroids.
yeah,
Yes. So
no, no.
so
And it takes
thank
long. It takes at least 5 years to 5 centimeter become 3 centimeter or 10 centimeter become 5 centimeter. It takes 5 years.
so
So it's not like immediately
I
after menopause by a
know.
month or two just disappear. It doesn't disappear like that.
So yeah, and it's
Mm.
not fair to ask any woman to wait for menopause to sort out the fibroids issue. Please
No, no.
can caregivers stop telling women to just wait for
Mm.
menopause. Thank you. Thank you. Awesome. Thank you for that. I'm going to ask you one more question, Angela, and I'm going to let you go to the bit where I'm actually interested in for wellness and well-being for women, something that I know you and I have talked about, which is the impact of journaling. But before I ask you that question, I also wanted to ask you, you know, if how stress and anxiety can influence, you know, women, and especially those living with fibroids, and what strategy would you recommend to manage this kind of factors? Are you there? Can anyone hear me? I don't know. Something is happening to my network.
I can hear you, but I think there's something happening in Angela's side.
Oh, okay. So it's Angela then, because she looks like she's frozen.
Mm.
Okay. While we're
Mm.
waiting for Angela,
Mhm.
I'll ask you one more question,
Mhm.
Miss Soma,
Yeah.
around fibroids. So I've had, okay, because we have a community of women, about 100 and, I don't know, 15, 17 women
Mhm.
in that community.
Mm.
And sometimes women are reluctant to, because first everyone keeps talking myomectomy,
Mm.
to say, oh, okay, Angela left. Maybe she's having
Mhm.
network issues.
Mhm.
Women. And so sometimes women are even reluctant to
Mhm.
treat the fibroids until
Yeah.
they start to have severe symptoms,
Mhm.
or bleeding
Mm.
that not manageable and all of
Mm.
that.
Mm.
But fibroids, if left untreated, will continue to grow.
Yeah.
And that's one fact that I wanted to put out today.
Yeah.
If you do not do something about it,
Yeah.
it will
Mm.
continue to grow,
Mm.
especially if you have not
Mm.
changed diet, if you have not looked into lifestyle,
Yeah.
fibroids will continue to grow.
That's true.
And in my own case, or even though, well, I've always known I had fibroids, but
Mm.
because I was trying to do a healthy lifestyle, but because I wasn't knowledgeable enough about
Mm. Mm.
what will increase the growth
Yeah.
of fibroid, I started taking the wrong milk, which was soya milk, and also was in a stressful job
Mm.
that made me drink a lot of soya milk with my
Yeah.
coffee, which
Yeah.
led to
Yeah. Increase the
uh,
size. Mm.
increase the size,
Mm.
me bleeding non-stop,
Mm.
and all of those things, and having to have blood transfusion every other month, and
Mm.
so honestly, it's important that women, and this is why we do this. Feminine Health, the FHF
Yeah.
Support Network is doing this to
Yeah.
amplify the voices of women and people
Mm.
who have lived and are still living with fibroids, honestly,
Mm.
because we're advocating for this. We're looking
Yeah. Yeah.
ways that women get the knowledge and information, because
Mm.
the knowledge, if you action on the knowledge that you have, it
Mm.
is powerful. Your life can
Mm.
turn out differently,
Yeah.
and you can live a better
Yeah.
life. I'm hoping that comes
And
back while we're
the
chatting.
surgery is not the only option. There are a lot of options now. The surgery up to 15 years ago was the only option, but nowadays there are other options. Each option is fit for certain person.
Mm-hmm.
So people should not be frightened to seek advice. And if they are in the hand of someone, I had 4 patients recently, to be honest, within last 6 months.
Mm-hmm.
They all being told you have to have a hysterectomy. They have no children. Yes, they are in their 40s, but it is very difficult to decide to have a hysterectomy. And they were in tears, and they were told that is your option. There's no any other option.
Mm.
And it's not. It's not. There are other options.
Yeah, absolutely. And that's another
Mm.
thing that,
Mm.
I like
Mm.
to amplify.
Mm.
There are alternative options, honestly.
Mm.
And I was gonna ask about if fibroids must always be removed. Because I'll let you answer that, Dr. Omar, but you actually answer that question first
Mm.
before,
Mm.
must fibroids always be removed?
No, there is other option which make the fibroids smaller and can pay. The woman can live, can have children, can have live with it for long time. At the end, may not need any surgery. So it's not only surgery is the option. We have a lot of option is coming up, but it is better to seek the advice, find out what is this, where is it, how many of them, and what is the size, and then 1, 2, 3, and argue with your medical people.
State your case.
Say, I have
Absolutely, I
heard,
agree. I
yes,
heard Dr. Omar say
I
argue.
heard about this, that. Why you not offering it? Because some people, if they are tired or they are seen many patients, then they are just fixated in one treatment. So when you argue and say, I heard about this, then they remember. Or then they say, oh, I can't do that, but I will send you for somebody else to do that.
Absolutely.
So you should argue, you should not say immediately when the consultant or the registrar said that's your only option, say, but I heard these are other options available. Why I shouldn't be offered? What is the reason I am not offered? That time, that person, either they have not thought about all of those things, then they start thinking about it, or they cannot do it. So then you say, then they say, oh, I'm not doing that because I'm not available, or I am not experienced on that. So send me to another person which can do that.
And absolutely,
Mm,
thank you for raising that, Dr.
mm,
Omar, because
mm,
it is key. As a patient, you must do your own due diligence.
mm,
You need to explore.
mm,
That's why, honestly, we're big on
mm,
education
mm,
at Educate
mm,
Support Network. Educate yourself.
mm,
Get information.
mm.
Ask questions.
Yes, why
That's
not?
the only way that when you
Mm,
go to see your physician or your
mm,
healthcare provider, you can argue
mm,
your case. You can state your case like, okay, if
mm,
it's offering you this option,
mm.
these are all the options that you've looked into. What else applies? Because sometimes, excuse me, as a patient, you might not even know because
No, even the doctor may not remember or may not write about it. I had a patient, she came for menopausal symptom 8 o'clock in the morning. It was snowing that day. She jumped to the window, she opened the window and took her jumper off, and she said, I want a HRT. And I was explaining, then she said, have you read Guardian this morning? I said, not really. I just drove 1.5 hours, to be honest. She said, there's a new HRT. I want that one because it was in a Guardian this morning. I said, to be honest, I haven't read it. So she was upset. I said, don't be upset because I had no time to read it. If you want me to read it, I can read it. You can wait half an hour and can read it, and then we go for the discussion if it's fit for you, or come back again. So it's not insulting, but things sometimes we forget. So it's better to argue with them. Say, I have read this. Did that fit me or suit me? And then they will remember.
absolutely.
Why not?
Doctors are human as well. I
Yeah.
mean, you
Mm,
mean that you know everything. Also,
mm,
so the patient also getting knowledge, getting
mm,
information,
mm,
also
mm,
will
mm,
help prompt things, you know, that
mm. Yeah.
said the doctor has forgotten or didn't think they qualify for. But
Mm, yeah.
because at some point I thought
Mm,
I qualified for embolization, but
mm,
after many more tests, they said, "Oh,
mm,
maybe we're not because some of those fibers are sitting in places where we can't even do that,
mm,
you know. And what's the
mm,
point, you know, of going through all of that procedure
mm,
when I'm
mm,
still left with
mm,
the same issue after that
mm.
procedure?" So it's
Yeah.
important that women also
Mm.
do their own due diligence. Thank you so much. It's been interesting talking about some of this myths and the facts around fibroids. Before you went off, Angela, you were gonna I was asking you about, you know, how stress and anxiety influences fibroid symptoms, and if there's any strategy that you have to help women manage this, and then we go to journaling, how that also helps well-being.
Yeah, well, it's good to be back. I mean, not even bad Wi-Fi can keep me away from this conversation. So it's good to be back. And yeah, it's. I'm just before I answer your question, I'm going to touch on what Dr. Omar said. You know, so because my career, you know, my background actually was in the healthcare industry. You know, and
Mm.
I think one key thing is you can't afford to be passive when it comes to your healthcare.
Mm.
You need to be very, very proactive.
Mm.
And I love what she said about how there's nothing wrong in suggesting things to your doctor or your clinician, because they're human after all. They don't know everything, you
Yeah.
know, and really we should be at the forefront of our own health. It's just something that, you know, I believe we need to do, to be honest. But then touching on your question with regards to stress and anxiety, you know, some of the things that you said earlier on just brought that to my mind. For instance, the impact that fibroids can have on a woman's fertility journey. Now, that can be very anxiety inducing. It can be very stressful as well. And I think the key thing is, first of all, understanding what you're dealing with. You know, you were talking about education and information, knowing where they are, knowing the signs, but then also coming to the point where you take a step back. Because, you know, when all of this is happening, it's a lot to take on board.
Indeed.
It's a lot to take on board. Initially, like I said, you'd have that relief that at least we know what's going on. But say, for instance, a woman is dealing with infertility. That's a really, really big thing. Nobody in court anticipates that, because it symbolizes a lot of things to women. It could symbolize the end of a dream. It could symbolize issues, potential issues coming, you know, okay, for instance, how will my journey be? Because you can't tell until you ideally will really get to the end of the journey. So that, just that aspect can be very stressful.
And culture,
if one decides, there's also the cultural aspects. So in terms of dealing with stress and anxiety, I think it's important to just take a step back, and take a deep breath, and come to terms with the situation first. And once again, we talked about support system. Find someone that you can express how you feel to. Don't make any long-term decisions just based on how you're feeling in that moment.
Oh yes.
You know? And you know, just you need to have the right people who will encourage you, support you. And I think also, yes, it's a really big thing, but also come to the point where you recognize that your life does not revolve around your diagnosis or the potential impact it could have, you know, and it's a daily thing. And I'm not saying it's easy. I'm not going to sit here and say it's an easy journey. It's not. It can be one of the most difficult things one walks through. And so in terms of dealing with the stress and anxiety, this is where self-care comes in. This is where monitoring your self-talk comes in. Because sometimes when we're stressed, our self-talk then goes into overdrive, and we begin to see things a certain way. And so we begin to talk about things, talk about ourselves a certain way. And that's a really important thing. Monitor your self-talk. And that's why I was saying that emotions are not always the best leaders, because when we're in that emotional state, we're not necessarily being objective. So it's important to, first of all, acknowledge that, hey, I'm feeling anxious about this. That's the first thing. And then, okay, what can I do to bring that feeling of anxiety down? Perhaps phone a friend or speak to someone you trust. Express yourself. From a stress point of view, I mean, it's just looking at ways to find ways. How can I reduce that stress? Sometimes when it comes to these kinds of situations, as women, we put ourselves under stress. We put ourselves under stress. And really, it's just looking at, what is the source of my stress? Is it maybe someone's expectations of me in this situation, or is it due to expectations I've placed on myself in this situation? So we need to figure out, where is the pressure coming from? Because when you figure it out, then you'll be better placed to deal with it.
Awesome. Thank you. That's really helpful. Thank you. Come to terms with it. Take a breather, step back, and then reassess. Absolutely. Thank you so much for that. We have a few minutes to go, but I want to talk about Angela. And I know we've had this conversation about judging. I know about most women here on today, honestly, done wonders for me, writing things down. First of all, it helps me to remember, because I'm starting to get to a place where I don't remember most of the things, even conversations that I have. But honestly, it helps me to look at what I've written down and be grateful for some of the things, because you look at like, oh, actually, I didn't remember that I wrote that down, or that got done, that achieved that, or happened. Forget this thing, honestly. So tell us a bit more about the impact of journaling for our well-being.
Okay. Well, for me personally, journaling is a very big deal. I have been journaling. I've been keeping a daily journal for, well, it was 30 years last month. And I'm not sure if you can see this, but I have, this is just,
Oh, God, Angela. Oh, wow.
yeah. So I've got one, each of those represents a life of a year of my life. Obviously, I can't show you all my journals. I can't. But one thing that I've realized, having done this for that long, for me, I have found that it's been a game changer in terms of personal growth and professional growth. And from a personal point of view, considering our discussion today, I find that it helps you to get in touch with yourself. It makes you more aware of who you are as a person. It helps you to process. We've talked about emotions, helps you to process emotions, situations. And I must say that there is just something, like you were saying earlier, talking about how writing things down, there is just something about writing something down. It makes it more concrete. And as people, thoughts are not tangible per se, but they do have presence. But when you write your thoughts down, it makes them concrete. And so from a well-being point of view, sometimes you find that there are just times you can't even express yourself, but you're able to write. And so from a well-being perspective, remember we talked about getting it out. Talk to somebody. If you feel you can't talk to someone, write it out. The bottom line is you're getting it out of yourself, how you feel, or how, whatever it is you're experiencing. And it's also a way of affirming yourself. Talked about well-being. We affirm ourselves. It's so important. We talked about self-talk. Our self-talk is probably has the most impact on us than anybody else. So I find that from a journaling point of view, when you're writing about yourself, you can affirm yourself. You can write things like, what, today I felt however, I felt whatever. But you know what? I recognize that I am not how I feel. I am not my circumstances. I always say to women that, look, circumstances, we all go through adverse situations. But you know what? Our challenges are not meant to define us. They are meant to refine us. So when it comes to helping you, work on your mindset, writing things down matter. In fact, if you want, even from an affirmation point of view, you can write things down and put them where you'll see them, and you speak to yourself. Because your voice is so much more powerful than anybody else's.
Right.
Okay? It's so important. And I just want to encourage our listeners and viewers today that, look, grab a notepad. You might not do it every day. I do mine every day. If I don't, I feel constipated. But go through your day. Seriously, go through your day. I start my day with my journal. I end my day with my journal. It's a good way to process your feelings. It's a good way to process your experiences. And it's a really key thing for learning the discipline of gratitude. Human nature, we tend to focus on the negatives a lot more. And so for me, that's one thing that journaling does for me, and that I would definitely advocate for. Find at the end of every day, focus on three things. Just three. What am I grateful for today? Because even in that difficult situation, there's so many things to be thankful for. So many things. And gratitude becomes your attitude. So even when you're going through a difficult diagnosis, your perspective changes. I always say that gratitude is like it helps to clear your focus. And we become what we focus on. So those are some of the things that journaling will do for you. It'll change your perspective. It'll give you clarity. It'll help to ground you. It'll help you to process things. And I can go on and on, but I know we don't have much time.
That's true.
Honestly, and for me is even that perspective, because sometimes you don't, you're in this bubble, your mind is in this bubble, but right, it's interesting that even the Bible says that write the vision down, so that those who see run with it. But it is when you write it down, and then kind of helps you to start to think around it, and then you'll start to see things from a different perspective, and not just how your thought was narrowing initially. Honestly, and for me, that's how it works for me. Once I've written it down, and it's most of the time, I remember maybe almost 40-50% of the things that I write down. If I'm speaking to you, if I don't write down things, trust me, I go away. I don't forget. I don't remember half of the things. But honestly, apart from even remembering the things that conversations I've had or important things, also it helps me to, once I then look at it again, and then I start to think, gives you a different perspective, and then your mindset starts to change, and then you start to see that things are not even as bad as it's actually looking, and then you start to have some kind of relief, and you start to distress, like, you know what, I'm not going to kill myself. Things can happen. Actually, I can do things differently and all of that. And absolutely, we cannot overemphasize how journaling can your well-being, even on this journey of fibroids. And also, I've also found that even journaling, writing things down, because sometimes you have these symptoms and all of that. By the time you have an appointment that you booked with a doctor to go and see them, you have forgotten half of it. But because you've written things down, you can get in front of your doctor and like, oh, okay, actually, I had this, I had this, I had that. And that also helps them to be able to help you better, in diagnosis.
Yeah, that
Direction.
is so true. And like we're talking about gratitude, that is one of the best antidotes for stress and anxiety. Because like you said, it just changes you shift in your mind. You just have that shift, and that makes such a big, big difference. And another key thing is, let me let you into a secret. Your brain cannot handle unanswered questions. So when you journal, you can also ask questions. And one of the things that you find is, yes, you might write a question down, not necessarily know the answer, but guess what? Your mind is subconsciously working on it,
That's
working
weird.
on it,
That's weird.
working on it, and it won't rest until it gets the answer. So I was speaking, I was with a client just the other day. We were on the phone, and asked her a question, and she didn't quite know the answer. I said, look, just let it go. Let's move on to something else. It'll come at some point. If not now, it'll come later. But you know what happened before the call ended? She said, I know why I do this. And she was able to give me the answer. And I shared that with her. I said, look, it's because your brain just cannot handle not finishing something. And that's why. And so when you're writing things down, you're giving your brain the opportunity to process things. It might not be immediately, but at some point you'll get there.
Absolutely. Yeah, I was just thinking about that, how actually it helps to bring solution, because sometimes when you're having conversations or at the initial stage, even when you've written it down, you don't know what the solution is. But after you've written it down, somehow, I don't know how that happens, your brain kind of starts to work in a way that your thinking, your shifting your thoughts begin to shift, and then you're beginning to be more solution minded, more than looking at the problem, not, and honestly, we cannot overemphasize journaling for me has been helpful. It's worked. The other day I was saying to Angela that some of the things that in many years ago I wrote down, when I picked up, I just found that journal randomly, and I was like, oh my god. And I was just checking and thinking of like, this has happened, and all of that, and it just helps you to be grateful, and to just attitude. And that also is happy place, where also there's a kind of hormone that secretes in it. It just also helps you,
Yep.
you know.
And one thing that you've just reminded me of also is that with journaling, when you write, like you said, you went back years, a good few years, and you saw this. It's also to encourage ladies that, guess what, this too shall pass. Okay? Because when I go through my journals, I'm reminded of challenges that I went through. But guess what? I'm still here. The challenges are not. So wherever you are in your journey, just know that it's not permanent.
That's right.
That's why it's called a journey.
Yeah.
It's a journey, you're moving. And so just be encouraged, wherever you are, just know that it's not going to be like this always.
There is hope. This too shall. Thank you, Angela. That is so amazing. Oh wow, we've gone past the time, but it's Fibroids Awareness Month, and honestly, for us at FAH Support Network, is about advocating, speaking up about these things, bringing solutions, helping with discussion and relevant conversation to help women, on this journey. And well-being and thriving to live the best life that you can. Thank you, ladies. It's been a wonderful, wonderful time having this conversation with you, and I hope people who joined us today and people who are going to be listening later on, be able to take something away. Thank you, ladies. I am grateful for you
Thank
to jump
you.
in.
Thank you, Angela. Lovely to
Thank
meet
you.
you.
Thank you, Dr.
Thank
Umar.
you.
Yeah,
Thank
nice
you.
to meet you
Yeah.
too.
Thank
Lovely to
you
meet
so
you.
much. Next
Thank you so
week,
much. We meet again.
in 2 weeks, we're bringing more women to sharing their personal
Yeah.
journey. Forward to
Yeah.
women are going to be sharing their story, and for us, it's just about bringing hope that, like Angela said, this too shall pass. Honestly,
Yeah.
there's no. It's a journey.
It's a
It's a journey.
journey. Every day is a journey. Waking up well and going to work. That is the bonus.
Yeah.
It's a journey.
Yeah.
Yeah. Yeah.
And our trials and our journey
Mm.
be capacity in us, honestly, and like we started, because each and every one of
Yeah.
us, our scripture in Romans 8:28 says, "Welcome every detail of our lives is continually woven together for good, because we are His
Mhm.
love and we have been called to fulfill His designated purpose." So all of these things are working together for good for us. Somehow, you might not feel like it at that point in time when it's happening, but trust me, eventually, when you look
Well,
back, you know that this has built some capacity, giving you something much more that's it's not even tangible. You can put your finger, but it gives you capacity to be able to do much more according to His designated purpose for your life. Thank you, ladies. It's been a wonderful
thank
conversation.
you. Have a good evening.
Everyone
Thank
Yeah,
who's
you.
see you.
there, have a
Bye.
God bless.
Bye.
Yeah.
Bye. Bye.
Bye.
Good night.
Bye.
Bye bye.
Bye.
Thank you, everyone who's joined us today. I hope you've been able to take something away, and see you again in 2 weeks' time, where we'll be women from our community will be sharing their own personal journey of fibroids. Thank you, everyone. God bless. Good night,
Yeah.
Angela. God bless you.
Bye. See you soon.
See you soon. Bye bye.